Please welcome back to the program Dr. Jeffrey Barke. Doctor, what the hell did the head of CDC and Dr. Fauci just say?
Sage, great to be with you. Here, what he said is, if an individual continues to have a high level of hysteria and media-driven fear, then by all means, continue to wear the sign of obedience, and that's a mask. I think that's what he said.
So, Dr. Barke, just the other day, I'm watching an interview with a woman named Randy Weingarten. She's the head of the second largest teachers union, and she was hedging on whether or not schools should be fully open for in-school learning by September. 24 hours later, she says schools must open now, in-school learning in September. There's clearly pressure on CDC, I think, from people, Dr. Barke, who have just had it. They are fed up. They're fed up with the mandates. They feel they're being pushed around. They feel the science is not, in fact, being followed.
You're absolutely correct, Sage. This is not a science debate. This is a political debate. And the teachers union has weighed in on the political fight. And make no mistake about it, the teachers unions care not about the children. They care about their union members. We've known for years now that children, asymptomatic children, do not spread this illness, that they are at very, very low risk of COVID-19, and that schools should have been open a year ago without masking of small children because there's no evidence to support that. Political, not science.
Dr. Barke, there is a new vaccine for teenagers, I think 12 to 16 years old. Should somebody in that age category take a vaccine for coronavirus?
Makes no sense to me, Sage. Why would we vaccinate a person who is at very, very low risk? Remember, less than 20 years old, survivability of COVID is 99.997%. A child has a higher risk of being injured from seasonal influenza than from COVID. So it makes no sense to be vaccinating a child with an investigational vaccine with limited testing using brand new technology that's never been used in a vaccine before. It doesn't make sense, yet the government, Dr. Fauci, and other agencies are pushing this upon our children.
My guest is Dr. Jeffrey Barke. Doctor, I'm looking at a little notice I get every morning from the New York Times. The New York Times, of course, has been quite hysterical about the coronavirus. And there's a guy named David Leonhardt who writes a lot about health care. He's a big Obamacare supporter. And he talked about the CDC announcing that, quote, less than 10%, close quote, of COVID-19 transmission was occurring outdoors. And then he wrote that this is apparently a huge exaggeration. And one virologist at University of St. Andrews said, in truth, the transmission outdoors seems to be well below 1% and maybe below 0.1% or less than 1/10 of 1%. That's a big difference between 1/10 of 1% and 10%.
Yeah, you think. And remember, in California here, our soon-to-be recalled Governor Newsom, early in the pandemic, decided it was a good idea to close Orange County beaches, probably the safest place you could be. The wind is blowing, the sunshine is shining, plenty of room to separate, absolutely no risk. This is not science, this is politics.
My guest is Dr. Jeffrey Barke. Dr. Barke, there's an economics professor from Canada named Doug Allen, and he said he initially supported the mandates, but then he said many of the predictions, the policies were based upon, quote, false assumptions and tended to overestimate the benefits and underestimate the costs, close quote. That's a economics professor from Canada. There's another professor, a doctor from Canada named Ari Joffe, Joffe, specialist in pediatric infectious diseases in Edmonton. And he wrote a paper called COVID-19 Rethinking the Lockdown Groupthink, and he said the same thing, that initially we did not properly consider both all the costs, including all the collateral damage, depression, homicides, domestic violence, opioid addiction, loneliness, job loss, all the things that you and I have been talking about. All of a sudden they finally realized, oops, we should have taken those into consideration.
Yeah, absolutely. You know what, Sage? It's pretty cold up there in Canada, so we need to give our Canadian brothers a little bit of a break. But you're absolutely right. We have known now, especially with children, that the lockdowns have caused far more harm than the virus itself. The kids have been devastated. There's been more kids that have died from suicide than have died from COVID-19, not to mention that this lockdown has disproportionately hurt minority kids that can't afford necessarily to make alternatives and go to a private school or hire a tutor, et cetera. So we're crushing the kids and the same group of people that we claim to want to help. It's ridiculous. It's time to get our kids back to school. No masks, fully opened. Enough already.
Dr. Barke, I want you to react to Dr. Fauci back on March 8th. You and I have talked about this. Now, given what we've now learned, I want to know if you have any different reaction to this. Let me play it again for you. It's about 45 seconds long.
Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are.
And when I said March 8th, obviously of last year.
And really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course. But when you think masks, you should think of healthcare providers needing them and people who are ill.
Now, Doctor, the last time we talked about this clip, I told you I thought he was telling the truth. You told me you thought he was telling the truth, meaning he was going with the available science at the time. Then later on, he said he lied on purpose so that people would not have a run on the face masks that are needed by our frontline professionals. Real quickly, in the last few seconds, what's your reaction now?
Fauci was right on that 60 Minutes interview, as was the New England Journal of Medicine and other healthcare bodies. Then he got wrong, and now he's getting right again by saying you don't need to wear a mask if you're vaccinated.
Dr. Jeff Barke, COVID-19, a physician's take on the exaggerated fear of coronavirus. Doctor, thank you very much for taking the time, as always.
Thank you, Sage.